All right, I got Catherine and Lydia with me today to talk about a case that they had recently. I'll let them tell the story.
Okay, so we were back in OS and we didn't get a case at first, so we were waiting for something to come off the floor. A patient came in to an on-call chair. They had a vertical root fracture on 30.
Yeah, and there was a CBCT which showed that pretty clearly that, yeah, we'll show you.
Yeah,
So we did the endo 5 years ago.
yeah.
Did a 1 year recall and said looks like it's healing okay. Saw it 4 years later and basically said, yeah, probably a vertical root fracture. You guys didn't do the
No.
on-call chair or
No.
anything, so you just saw him at the
Yeah.
end. But for context here,
Also,
the
this patient had come in over the summer
Yeah.
to acute care a few times. He had been a little bit frustrated with the process, was a little bit frustrated when he came back to us, but we had just seen him based off the floor.
So got a cone beam same day, which not all that common, but same day. Dr. Paneer did the report, said strongly suspected distal root fracture, not likely to be restorable. You can see the
And there's a lot of bone loss into the furcation as well,
nope,
which,
and lesion that's going towards the IA.
Yeah.
So you saw the patient and you talked to him about, hey, we're taking out a tooth. Any questions? You went through med history. You're the second people that went through med history that day. Tell me a little bit about that.
so for the med history, he was a little bit of a diva from the get-go. He was just a little bit stubborn when it came to things. He said that he did have a quadruple bypass, but it was over a decade ago. And we kept asking just because when you see that, obviously that kind of raises a red flag. He he was like, oh no, everything's fine. He also wasn't taking any medication related to that. He said he was like, I go see my cardiologist quite frequently. Like, everything's been fine. Like, he said that everything's normal. Like, everything should be fine. His biggest concern was he did have an infection with the tooth. And so
Mhm.
he just kept kind of wanting us to prescribe him more
Right,
antibiotics.
right.
And that was kind of what he was focusing on.
Yeah. And that's what he had
Yeah.
in acute care over the summer. That's what he had come in and he had gotten a prescription for amoxicillin.
Yeah.
And he was just wanting A, more of that, and B, something stronger for pain management and infection
Yeah.
after the fact too. And we were just kind of trying to tell him that we don't really do that right now and we can't say now. We like to take the tooth out and then
Yeah.
clean out the infection and let you, heal naturally and manage your pain with just the Tylenol and ibuprofen.
We kind of do a pretty conservative approach. So with the med history, though, he kind of kept being a little dodgy, I would say. And he just was like, oh, yeah, no, that's fine. And then would kind of focus on what he wanted to get out of the procedure and just kind of meeting his concerns with it. So,
So in retrospect, you kind of had that spidey sense of like,
yeah,
this guy's there's a
something's
little
going
something
on.
off, but he didn't,
Yeah.
say anything, and
That-
you asked in multiple
yeah.
different ways, and he
Yeah.
never said anything of other than
No.
basically clean medical history, other than he had a heart attack 10 years ago
Yeah.
and then a quadruple bypass, but not on Plavix, not
Yeah.
on aspirin, no stents. I don't know how you get no stents with a quadruple bypass, but
Yeah.
according to him,
Yeah.
no
Yeah.
things. And someone else had already gone through med
Yeah.
history, and he's an active patient in the school, so he's been seen many, many times, and this is what
Yeah.
his med history looks like.
Yeah, and he was pretty adamant about he even used the words that yeah, my health is under control,
Yeah.
which kind of led us to believe
All
his
right.
health was under control.
So I'm going to give you a one-time special pass to say the swear words. How was the extraction?
The extraction was so easy. So there was a significant amount of bone loss around the furcation, so you could actually visualize where you put your forceps in. It probably took longer for Lydia to scrub in than the entire procedure did.
Yeah, it was done when I got back.
Yeah,
No.
it was a very straightforward procedure for sure. So, we were conscious of the IA. We did cure it pretty well, but just tried to avoid it since there was active infection.
Sure.
The
So
mo-
curated laterally, just not
Yeah.
apically.
Yeah, and then I would say the most difficult part, honestly, of the procedure was getting him numb, but that wasn't even difficult. We just knew we were mindful that there was an infection. So we kind of just did a little bit more of like PDL injections, stuff like that, just to kind of counteract the infection, which.
And the fact that he was being a little high maintenance, you wanted to make sure you got him adequately numb before you started doing anything. So he should have, based on the extraction, not expected a whole lot of post-op issues because it went very straightforward. So tooth was out.
Yeah.
What happened then?
So then we started to sit him up. We were talking to him, and he was like, "Oh, is it out?" And like was almost shocked. He was like, "Oh, okay, yeah." Like, tooth is out. Like, I think he thought it was going to be a longer process. So then we started to sit him up, and he just starts to panic, for lack of a better word.
Yeah.
He says that he starts to feel a little bit dizzy. Kind of just is like, I'm feeling dizzy. I feel like I'm going to pass out. So then we decided to put him in trend because we just were like, this is not really good.
Yeah.
Good idea. So then we started to put him, we noticed that he got a little bit pale and sweaty, I would say. So then he just kind of started to panic, and then we asked if he felt okay. He said that his chest started to feel a little bit tight.
Yeah. And his arms were feeling numb.
His arms were feeling numb, and his chest started to feel a little bit tight. So then we didn't panic, but we grabbed Dr. Trennan, and we said, hey, we put him in trend. We aren't sure if we should give him nitro, what we should do.
Yeah.
And so then we started taking off his shirt to put the EKG leads on.
Yeah.
And we noticed that there was a heart monitor that was already present on the patient that the patient did not tell us was present.
So kind of a whoa moment.
Yeah, so something was clearly being monitored. Probably wasn't something that he just got for fun. So we were asking him a little bit. We were like, okay, so what's going on? Like, why do you have this? And he's like, oh, I don't know. Kind of started saying, I don't know. At one point throughout this, he does inform us that the next month he was getting an ablation and they're having a specialist fly in to do the procedure. But when we asked why he hadn't told us, he said that if they could wait a few months to do the surgery, he didn't think it was all that important to tell us. So that's why he didn't share it with us.
And then when we did get the leads on, it was pretty clear that he has an arrhythmia, which we also weren't informed about.
Yeah.
And he maybe isn't the best historian
No.
to trust on this. So definitely someone that probably should get a med consult for any further treatment.
Yeah. So then he started, then it gets a little bit crazy. So then after that, he kind of starts to slur his speech a little bit. He just kind of is very disoriented. And so then we were really just like, I'm not sure what's going on.
Grabbed Dr. Rachel.
Yeah, we grabbed Dr. Rachel. He started saying that when we asked where he was, he started saying that he was in hell and that he was smelling burning flesh and seeing dead people. So then this is when we kind of started to think that this was a little bit out of the ordinary. And just everything was a little bit strange. But then Dr. Rachel came in and started talking to him, and he became a little bit more stable and coherent. But
I think he realized that when we brought Dr. Rachel in and we were starting to talk about doing more serious things, like preparing for him to be having a stroke or a crash or something, that he was like, oh, dang. And at that point, he goes, I'm just kidding. I'm not smelling burning flesh. I'm not entering hell. Like, I just saw that in a Hitchcock movie, and I just thought it'd be funny to try.
So he was just kind of messing with you, too.
Yeah.
But also has the heart monitor, also has a very likely possibility of having a heart issue. So the management of this patient, the toughest part by far.
Oh, by far.
Not in any way the extraction.
Yeah.
Obviously, you were successful with that. You were successful with anesthesia and a tooth that had a lot of infection around it.
Well, also, too, so kind of going back, we had asked him, we were like, have you ever felt like this before? And at first, he just said, he was like, yes, over a decade ago when I had my first heart attack. And so then we were kind of like, oh, great. But then he said later, we were like, so has this ever happened before? And he's like, yeah, this happens every time I get my anxiety attacks. And so we were like, we didn't know you got anxiety. Like, you had never said anything about it. And he's like, well, why is that relevant? So we kind of started to believe after when we looked at his vitals, they were still pretty stable. Blood pressure was pretty good throughout the whole time. We were monitoring his vitals obviously very closely as you do in this situation. They started to return to normal. So that's why we kind of deduced that it was an anxiety attack over anything a little bit more serious, just because it was returning to normal and he did say that he had a history. So that was another thing that I felt like as this case went on, a lot more information was given than at the beginning. And it was, for lack of a better word, like pulling teeth trying to get his med history out of him.
Yeah.
Because he wasn't sharing everything. And then he'd just drop little tidbits that like kind of started to make more sense.
And somewhat hard to know what was real and what wasn't after he told you he was just kind of messing with you.
Yeah.
So, like, I was in acute care that day, so I was very close and could hear this guy because he'd started making quite a bit of noise.
He was quite the road.
But you two did a really nice job of, first and foremost, asking him in multiple different ways, what's going on, getting the med history as best you could from him, but, you can only do so much with the patient. If they're not willing to tell you things, there's not much you can really do there. You can always do med consults, but if the patient says they don't see a cardiologist or don't see a physician, you don't have anyone to consult with.
I did also think too, this is just a kind of a random point, but I thought it was a good thing that I would like to do where Dr. Trennan, when he started saying he was like, oh, I'm in hell, he kind of reworded the question, said, okay, so then what were you doing here? Like, how did you get to hell? Yeah. And then he said, oh, I'm getting my tooth pulled, which people don't love the dentist. So obviously that's not the situation where you should say that, but he was not really happy to be there and did not like, and that was his own personal form of hell. But then when he started saying, oh, I was getting my tooth pulled, that kind of made me start to realize like, oh, he's a little bit dramatic, but he still does know where he is.
Yeah,
sure.
Whereas instead of being like a figuratively giving it the nickname, I guess.
And looking back into the past of the times he'd been in acute care and previously seen the school, he did not want an extraction.
He didn't have a great experience.
He wanted every chance to save that tooth. Where we did antibiotic and said come back to do a cone beam, didn't come back. I think there was another antibiotic, basically the exact same thing in over the summer. There were multiple times where he probably should have had the tooth out, but didn't. So obviously a patient that was not interested in extracting the tooth unless absolutely needed came into the on-call chair. They were able to do the cone beam same day, luckily, found what was going on and said, hey, the only option here is extraction, not just kicking the can down the road with another antibiotic.
Yeah, so this was kind of his worst case scenario, and I think it just kind of caught up to him, and so he was a little bit dramatic when it came to explaining that, but then it kind of started to make sense, and the way Dr. Trennan kind of kept rewording the questions, I thought was something really useful, because I feel like you would hear that one and just his first answer and just panic, but kind of stay on him and make sure that, so what do you actually mean by that, was a good way for us to realize, oh, he is more coherent than we think.
So he kind of went with it.
Yeah.
Instead of saying, okay, crazy person. We're talking about being in
yeah.
hell, smelling burning flesh. He said, okay, tell me more about that. What does it smell like? Does it smell
Yeah.
like hamburgers?
Exactly.
You just kind of lean into it.
Yeah. And then he kind of came to, and we started to realize, like, oh, this isn't, because I feel like when you hear that, it would have been really easy to just, like, stop asking questions, because that's obviously an insane answer, but yeah.
Cool.
So, yeah.
Any other thoughts for people listening to this in the future of, the big takeaways I would look at is ask multiple different ways when you're asking about med history, especially if there's something there that doesn't quite match up, like quadruple bypass with no meds, no stents, no things. And then make sure that if you're getting a patient from the floor or from someone else or referral, don't just assume someone else has already gone through med history and that sort of thing. Trust but verify. Make sure that you're going over it as well, especially when you're doing surgery.
Yeah. I feel like it's just kind of know your resources too, because like everyone around was so helpful, and like I feel like we both felt super supported and like kind of knew what to do, because we are trained well enough that we could have handled it on our own, but also asking was a very good resource, and just to kind of see. And like when you're in school,
We debriefed after and we talked about what we would have done if it actually had been a stroke or a medical emergency like that. So we kind of reviewed, which was also really helpful. Yeah.
So in the end, he recovered fine.
Yeah.
Had him sit there for a while.
Yeah.
Basically said, yep, exactly like all of his previous anxiety attacks that he gets somewhat regularly.
Yeah.
And that he did not feel numbness in his hands, didn't feel any tightness in his chest, and maybe didn't to begin with.
Yeah. We really stressed if you feel anything out of the ordinary, you should go to the ER for the next 3 weeks, 4 weeks, however, until this ablation. So we really stressed that too.
Cool. Thank you, ladies.
All right. Thank you.